to invite her today to give us her perspective, and especially how that might interact and how planetary health plays a big role in laboratory medicine, which I'm sure we all notice on a daily basis how that might, how our work and may have a big impact on this, and how we may have a big role to play in sustainability. On the laboratory medicine side, we'll have Dr. Andre Mattman speaking to us also. He is a medical biochemist, the division head of chemistry at St. Paul's Hospital, as well as works in the Adult Metabolic Diseases Clinic at VGH. And as we discussed over the past few weeks, very passionate about how planetary health and sustainability is important in the labs. And finally, Dr. Tyler Smith, hematopathologist at Vancouver General Hospital, and also a committee member on the VCH Planetary Health Committee. And he'll be giving us his perspective on this as well. So without further ado, I'll pass this off to Dr. Rashmi Chadha, who will give us a quick perspective and hopefully stimulate a lot of great discussion on this towards the end of this session.
Yeah, we can see your slides, Rashmi. But you're muted. There you
go. Oh, you're still muted.
Yeah.
Let's see if we...
Sorry, everyone. It just wouldn't be a Zoom meeting without someone being muted. So I'm really excited to speak with all of you about this topic. And I'm just going to move my little widget so I can actually see people while I'm presenting. So land acknowledgement has been done already, but I'm grateful for the stewardship of the earth, air and water, and aspire to learn from Indigenous teachings about how to be a good ancestor for this and future generations of those who live and interact with our great Mother Earth. These are the different areas where the different nations whose land I live on. I have nothing to disclose, which isn't entirely true. I'll disclose I'll be trying to convince you to take the health of our planet as seriously as you take that of yourself, your loved ones, and your patients. So going to talk about a little quick primer on climate change and planetary health. We often hear about the scourge of climate change, but the triple threat of this, pollution and biodiversity and ecosystem loss, is connected together less. In my circles, the planetary health crisis is all three of these items intersecting and interacting, and parts of this presentation will address that. The world is getting hotter. We're already at 1.1 degrees warmer than pre-industrial averages, and we're now starting to break the 1.5 degree threshold. Many think this sounds like an innocuous amount, but in case we forget, we know very well in our own line of work that a 1.5 degree temperature difference from baseline can wreak all sorts of havoc with body systems. Our planet has a natural greenhouse effect, which all of us are aware of, which is the sun's solar radiation, warms our planet up, and that heat is radiated out and leaves the space. It goes off into the atmosphere. Unfortunately, because of the greenhouse effect, we have more harmful gases in the air, particularly carbon dioxide, which is 50% of greenhouse gases. And that basically acts as a big blanket around our planet. So heat comes in from the sun, but cannot leave out of our planet as efficiently because of this blanket of gases. And this is, simply put, why our planet is warming. The extent to which current and future generations will experience a hot and different world depends on the choices we make now and in the near term. So I really like this diagram from the 6th Intergovernmental Planetary Climate Change Report, which is an annual report that comes out. We hear about it in the news every year, and then we all forget about it after a few days. Future emission scenarios on the right-hand side there shows that if we continue with very high emissions, we are going to be getting significantly hotter. So that graph that I showed you on the previous page is going to be showing higher to the red zone. And what does that mean? I really like this because of the generational stuff it shows us. So people born in 1980, which is, I should imagine, a few of us who are presenting today in that 70s and 80s period, will be 70 years old or so in 2050. And if we notice, look at the different heat mappings that we could see could occur anywhere between 2 to 3 degrees warmer, even with intermediate scenarios of the planet getting warmer. Why does this matter? Well, we can see based on that report that at present at 1.1 degrees warmer, we're having double the frequency of droughts and 1.3 times more frequent precipitation. This is on old climate modeling. Climate scientists are increasingly sounding the alarm that their modeling isn't working because we're actually going much faster. We've already started tipping towards 1.5 degrees for the last couple of years. And that means all of those things, droughts, floods, and cyclones, are going to increase. As you see, 4 degrees warmer is really just not somewhere we want to be going, having more drought, more cyclones, more precipitation. Why is the climate changing? Well, the easy answer is because of fossil fuels. This graph really nicely shows how our use of different fossil fuels has gone up and what the source of the fossil fuels are. So although coal is dying off, oil and particularly natural gas are taking off in replacing coal. Natural gas is just methane. That's greenwashing being called natural gas. But why is it getting warmer is actually a better question than they're just fossil fuels. It's because we have a disordered view of the planet as an infinite resource. The majority treat other living things as commodities here to serve us. And most have forgotten or never knew that we're part of small and large interdependent ecosystems, including those in poor countries who have limited resources, who make, grow, and dispose of things we consume, non-human species, the land, air, and water, and the generations of humans and non-humans that come after us. I know that Andre's going to get to that in his presentation. Pollution we're all aware of. I won't belabor the point other than to say this really nice report card for how the provinces and territories are doing in managing plastic pollution shows that whilst we get an excellent A star in BC for residential recycling, we do quite terribly on all other aspects. And this is remembering as we look at the new data that's coming out about microplastics. A recent study just this month showed that there's a much statistically significant increased risk of microplastics in the placentas of preemie babies. There was something out in the news yesterday that we all have a spoon of plastic in our brains because apparently our blood-brain barrier is not impermeable to microplastic. We don't know what the clinical implications of that is. Issue 3 is biodiversity and habitat loss. Although all the people are just 0.1% of 0.01% of all living creatures, we've caused the loss of 83% of all wild mammals and half of plants. Protecting biodiversity is important for a number of reasons: diversity, protecting freshwater, speeding up recovery from natural disasters, everything in this list. And I really want to identify to all of you that we have dramatically reduced the amount of animals on the planet. 4% of the Earth's mammal biomass is wild animals. 4%. 10,000 years ago, it was 1% humans and 99% wild animals. Of course, a lot has happened in that time, including industrial agriculture. But if we look at the breakdown of the numbers, the animals that are around now are pretty much all there to support us and our lives. So cows are heavily represented, 35% of mammal biomass. That's from beef and milk. Pork is for pigs are for pork and heparin, and then we have other ruminants lower down. So, really we have really commodified the animals on this planet and are taking out other animals. Our populations of birds are decreasing significantly. Populations of invertebrates, including essential pollinators that we need for our food, are down. Butterflies 53%, beetles and bumblebees at 50% approximately also. So why do we need to protect biodiversity and ecosystems? Well, I gave you some reasons, but I think these are important reasons too. It's our responsibility as the dominating species to preserve and maintain beauty and wonder, to stop being speciesist. We're all connected, and for future generations to enjoy all that we have to thrive. Excuse me, moving on to the bidirectional relationship of our health with the planet's health. Planetary health is a fairly recent concept, which in its common everyday use essentially refers to the interdependent bidirectional health of humans and the planet's ecosystem. Put simply, a healthy planet leads to healthy, flourishing humans and communities. Conversely, an unhealthy, sick planet with a fever leads to poor human, physical, mental, and social health. In a more complex equity and justice-based paradigm, I like to think of planetary health as a broader than just human-centric model, with additional inclusion of the health and right to health of fauna and flora. This has been described for many years as One Health. Anthropogenic climate change has led to many harmful effects on the planet, which we're all too familiar with. The destructive Californian wildfires a few weeks ago and back-to-back snow events over in eastern Canada have reminded us that destabilized planetary ecosystems don't pay attention to country, politics, race, or species. For example, high temperatures cause heat domes, which in turn affects humans by causing heat stroke and other medical complications. This list here is not exhaustive. And let us not forget that just as these climate events and changes in the biosphere affect our health, they affect the health of other organisms. Rather than think of this horizontally, we may suppose to think of it in a multidimensional way. I love this graphic from a must-read paper. We can understand the interconnected bidirectional interaction between human and non-human life from this. We see the human in the center with all the things needed for our individual microbiome's homeostasis, namely physical, emotional, cognitive health, a functioning genome, and epigenetic expression of genes. That unique biome thrives if we have all the items in the next light blue circle, specifically access to nutritious food, air, water, contact with nature, community, and safety. As we move outward to the dark blue ring, we see some of the different systems and structures that we humans from extractive cultures have set up and based our societies on. Broadly speaking, since the Industrial Revolution, we've used and misused the land, water, and air, and much of this is to do with an overarching belief in those cultures of human superiority and dominion. Our anthropocentric way of behaving and interacting with our living world has affected all those parts that make up the turquoise ring, and that in turn affects our food, air, water, and safety. We're inextricably linked. In care of patients, we talk about the social determinants of health, which are education, access, and quality, healthcare and its quality, neighborhood and built environment, and social and community context, as well as economic stability. In the holistic planetary health way of looking at things, we go one step further and think about the ecological determinants of health highlighted in the lower part of this slide. I've already mentioned microplastics, so I won't belabor the point, but that would fall within all of these things. As an example, so as I've described, ecological events and changes affect our health as well as our social determinants of health. So on the top line here is all of those different environmentally mediated human health effects we see. I'd like to give you an example. Last year, I looked after a patient awaiting liver transplant who became emotionally dysregulated with panic attacks on admission to hospital. She almost left against medical advice, even though it would mean not getting treatment, a new liver. The primary team looking after her thought it was because she was scared of surgery. She shared with me that it was because last time she'd been at hospital, she'd been in the emergency department, and that was during the heat dome of 2021. She was traumatized by the body bags that she saw being wheeled out. She also felt very destabilized seeing healthcare providers in tears, people that she is there had infinite trust to put her health in their hands, and they themselves were stressed and destabilized. After that day in the ED, she had nightmares on a regular basis about hospital and body bags. I diagnosed her with medical system originated PTSD. So this heat dome and the deaths and illness that resulted caused emotional distress to healthcare providers, patients, and their families. We should never forget that 619 people died in 1 week here in Canada. Another patient from Salmon Arm almost missed her cancer surgery because of traffic jams as she was trying to evacuate on the day before surgery. She only shared this information when I asked her how she was feeling about the evacuations from town. She broke down in tears and told me how scared she already was driving to Vancouver for surgery, but even more so once she, not knowing whether her belongings would or home would still be there when she returned. It follows that effects on our health and social determinants of health ultimately affect the ability of health systems to deliver timely and appropriate clinical care. An already stretched healthcare system can be overloaded by climate-related events. During climate-related events, we can have damage to health infrastructure, for example, a flooded building, supply chain disruption affecting provision of medicines and other important supplies, and healthcare staff themselves being unable to get to work. To exemplify the point, in August 2023, the city of Yellowknife was evacuated out of an abundance of precaution because of wildfires approaching. Patients who were being routinely treated in Yellowknife Hospital ended up being shipped out to other provinces. I had one such elderly widowed gentleman who had broken his leg on an e-bike, bless him. He was terrified. He was away from his family, away from his home, and not sure if his home would still exist when he got back. Moreover, VGH was absolutely ram-packed with patients from other from Yellowknife, as well as still dealing with our regular BC patients, because it's a tertiary care unit, and local Vancouver-based patients. So it had a significant impact on the healthcare service. How does the healthcare system affect the planet's health? My last few slides, I'm going to describe this to you. The healthcare system contributes to climate change. If it was a country, it would be the 5th highest emitting country in terms of emissions. It uses 7% of global non-metallic minerals and 4% of global metal ores. It also uses 5% of global fossil fuels. These are the different scope emissions that we look at when we talk about healthcare, the healthcare sector's contribution. Scope 1 is greenhouse gas emissions directly from healthcare facilities and is responsible for 17%. Scope 2 is those emitted indirectly through purchased energy and is responsible for 12%. And Scope 3, by far the largest contributor, and you can see that in the dark blue bubble, is responsible for 71%. And it's all the other indirect emissions. Our supply chains are 60 to 80% of healthcare emissions. I'll miss this slide, but this slide did look at effects on morbidity. So DALY's lost due to the effects of climate change. I'd encourage folks to read this Eckelman paper in general. It's a very good paper, even though it's a few years old. The references at the bottom. Other things to tell you about this pie chart breaks down how we use healthcare, how healthcare generates emissions. You can see food is a fairly significant amount, which is the food we give to our patients and on site. Pharmaceuticals is 25% of emissions. I think that's really worth thinking about. Plastics, rubber, textiles, paper, and then waste and water. These are possibly things to be thinking of from the pathology side of things. Bringing your attention to the food part, I want to tell you some really good stuff is happening. So, for example, reversing how we provide food in hospitals, instead of meat and animal-based products being the default, flipping it to being plant-based, with folks asking for less plant-based if they want to have that. It's an excellent opportunity to address upstream health prevention and promotion items by doing this. So the health system affects climate change, and in turn, climate change and all the things that happen to it affect healthcare delivery and human health. Comparing Canada's healthcare system, before we move on to, I know I've only got a couple minutes, so I'm racing through. Canada does contribute quite significantly to healthcare emissions. So we're 0.5% of the world population, as shown at the top here, but we create 2% of greenhouse gas emissions per capita. I think that's really telling. The most shocking one is the United States is responsible for 27% of greenhouse gas emissions, but is just 4.2% of the world population. Well, I can hear you saying, well, of course, the United States and Canada, we have the best healthcare, and that's why we make so many emissions, but that's not strictly true. This really nice paper from the Lancet, it's the Lancet report from 2022. In this graph, the point circle size is proportional to country population. The x-axis is per capita greenhouse gas emissions. The y-axis is healthy life expectancy at birth in years, with 60 at the bottom and 75 plus at the top. India has the lowest per capita healthcare emissions, but also the most dire healthy life expectancy. The US, as you see, has the largest per capita emissions, as I pointed out already, but it does not have the best health outcomes, life expectancy outcomes. It's the same as Mexico and Brazil. France is the powerhouse here. We can see that it's has lower emissions per capita, but also better quality of life. So we can, lifespan. So we can say that outsized carbon emissions are not a necessity to experience good health outcomes. So it's time to take our medicine. Very quickly, we want to move from, we want to effect change across the healthcare system. That can be done on a micro level, looking at individual, so self-knowledge, skills, attitudes, interpersonal, which is micro, so through informal and formal networks such as this, to meso, so moving on to healthcare organizations and institutions, professional bodies, and actually divisions of practice. And then macro, so at the macro governmental level. The exciting stuff is our federal government is stepping up. In 2023, the National Adaptation Strategy from Environment and Climate Change Canada outlined a shared path to a more climate resilient Canada and sets out a common direction for action across 5 interconnected systems: disaster resilience, nature and biodiversity, infrastructure, economy and workers, and health and well-being. As I've highlighted, all of these are relevant to us. Targets include, by 2030, consideration of health impacts and benefits are integrated into key climate change tools, guidelines, and standards. There's a lot of work to do. Clean BC is British Columbia's provincial strategy for moving to a low carbon economy whilst protecting the planet, been ongoing since December 2018 and is under the Ministry of Environment. Within Clean BC are accountability frameworks for organizations, including those in healthcare, to align operations with targets and strategies for minimizing greenhouse gas emissions and managing climate change risk. Clean BC's overarching goal is to lower emissions across the province by 40% by 2030. Our latest provincial Ministry of Health mandate to Josie Osborne very clearly had a line about UNDRIP and a commitment to take action on climate change being foundational and a key to a healthy and prosperous BC for future generations. In other words, climate change and UNDRIP are wrapped around the Ministry of Health now. I think this was tremendous. I really want to emphasize this was from Ministry of Health, not from a Ministry of Environment and Climate Change. We have a Ministry of Health mandate on this. Stepping up to the plate are our health authorities. And that's macro level, every BC health authority has or is developing planetary health sustainability strategies. These are just 3 examples that I include here. And aside from that, the energy and environmental sustainability arm of healthcare organizations is doing a lot of good work, and each year they release a climate change accountability report. A landmark 2023 report by Chief Medical Health Officer Dr. Patty Daly was a first of its kind MHO report on protecting public health in a climate emergency. So proud that Dr. Daly called it a climate emergency. That was visionary. She included mentioning that new builds should get off of methane, off of liquid natural gas, which I think was also very, very important advocacy piece coming from an MHO. At VCH, we have planetary health goals of reducing healthcare emissions and achieving zero unnecessary waste, creating a climate resilient system, and supporting communities in mitigation and adaptation. And the way to do this across the whole system is to reduce demand for health services. I know Andre's going to get to that, and I've highlighted some of the things we'll probably be talking about. Matching supply of health services to demand, the right patient at the right place at the right time, and making sure there's appropriateness of care, and then reducing emissions from the supply of health services. So with that, I'm going to breathe and hand over to Tyler.
Thank you so much, Rashmi. So
welcome.
Are we going to hand it to Andre? Did you want to go next, or I think Tyler's slides are a nice sort of segue into our discussion? So maybe.
Yeah, I'm okay with either one. Andre, do you have a preference?
Go ahead, Tyler. I'll happy to go last.
Okay, I'll go. I mean,
okay, go ahead.
In a way, like the way I kind of took what I might be able to offer for today's session is like Rashmi has a lot more experience in the kind of advocacy arm of things, and I think she really nicely laid a lot of the groundwork for like how big this problem is and how it can be kind of daunting and overwhelming to know what to do about it. And so I kind of just wanted to just share some of my early experiences with this, and then I think maybe Andre can go into some like he's been working at this a lot longer than me, and I'm kind of really excited to see what he's been up to and can share with us. So I'm just going to talk a little bit about my background. So, I'm about 10 years out of my training, and during my residency, even though I kind of started with more of a basic sciencey background, more and more I found myself drawn towards more practical utilization management projects. And really I didn't have any personal experience with committees even during residency. And it wasn't until I was on staff where, at the kind of nudging or support of some mentors like Blake Jilks, Monica Udoba, and others, that kind of got me involved in some committee work, which I actually kind of felt ill prepared for. But if you just join as a committee member, it's fairly low barrier, and in a way, like, there's going to be people kind of running the meeting, so you can kind of learn on the fly. And so I've been involved with the BC Association of Lab Physicians, organizing the PALS sessions, and a number of other things. And it's generally been like I would say a positive experience, and I feel like I'm always learning, and it does kind of add diversity to my day. And so I'll talk a little bit more about that. And so more and more I've tried to let my kind of interests and passions guide my involvement in projects. So if an opportunity comes up, I kind of like take a step back and like, is this something I want to get involved with? Or maybe there's something that I get an idea that is in line with this that could be compatible with my work. And so now I've tried to be more purposeful about how I spend my time in the projects I get involved with. From the Planetary Health Committee standpoint, I've always had an interest in planetary health. I've always tried to personally live my life in a way that's, fairly environmentally conscious. I've, always been kind of into alternative transportation, like biking to work. More and more, my family has been moving away from meat-based diet and towards plant-based alternatives, and that's kind of still an ongoing process, but it's something that, has been a good thing for all of us, and we've actually kind of really liked. And obviously, as Rashmi presented, there's a ton of evidence out there of climate change acceleration. And so there's obviously a lot of, responsibility that we all share as humans on this planet to do what we can to try to prevent what looks to be an impending disaster. And Andre Mattman, at some previous PAL sessions that I organized, and Andre was really good at kind of helping encourage me to do some PAL sessions related to climate change. But I also saw him being involved at St. Paul's in various climate initiatives. And so I thought that maybe that's something I might be interested in here at VGH. And so a couple of years back, the Planetary Health Committee here at VGH kind of put out, or VCH, I should say, put out a call for new members. And so I just applied because I don't think there's anybody on the committee from a lab perspective. And I kind of thought that maybe I could bring that kind of utilization management mindset, and even just maybe some things that might be kind of natural to have a lab perspective on. And really, like, I think utilization management should, it's really like a green form of practicing medicine. Because really, as Rashmi has alluded to, and I'm sure Andre will get into a lot more, current medical practice really encourages overutilization of tests. Like, the tests are easy to order. It seems like the default for a lot of test orders on inpatients is daily. It just seems to be like what everyone just assumes they should do. Medical trainees during their training are really more likely to be chastised for not ordering certain tests than they are for ordering excessive tests. So there's really like incentives are kind of towards just, oh, it's better just order it just in case. We have lab automation, which has made things considerably more efficient, but it also does enable this overutilization. And so by increasing our capacity, we've also just, in a way, encouraged this to happen. And really, anytime we kind of go to put up barriers or limits on excessive testing, we run the risk of having angry customers, either clinicians or patients, coming back. So a lot of times, us in the lab, it's the safer thing to do is just to do the test. And obviously these things as a whole are just going to lead to a large overutilization problem that we're dealing with. And so I think like if you think about utilization management projects, they kind of really help in a lot of ways. They do, I think, help with the patient care in that they keep the focus on important test results and not distracted by this other noise. You avoid the more tests you do, the more false positives you're going to get that might lead to unnecessary investigations and potential patient harms. You're phlebotomizing patients less, less potential transfusions. You're going to use your lab resources more sustainably, like you're going to be able to stay within your budgets. And obviously, we have a lab tech shortage internationally now. And so being able to use our human manpower more efficiently is key. And obviously, as the theme of the session is less environmental impact, whether it's energy, obviously, so much of what we do in healthcare is kind of one-time use only disposable items. Like we use plastic tubes and they go in bags and disposable biohazard waste. So obviously, there's a huge downstream effect of all this overutilization on the planet. And for me personally, like my experience at the Planetary Health Committee has had a number of benefits, even kind of selfishly to me. Like it's a nice, like these are nice people to work with. Rashmi is the prototypical example of that. And I've been involved in practical projects where you kind of feel like you can potentially improve practice and maybe even improve like the healthcare environment as a whole. Like Rashmi and I have been involved in trying to design a green space for there's this area of land on VGH that doesn't have a purpose, and we can potentially get a gardener to plant things, and you can facilitate these things that can kind of make things better in your workplace environment. I found it's helped me feel more tied into the overall VCH physician community, which I think for those of us in the lab, sometimes we feel a little bit separated or removed from that. And so it's been helpful that way. And it's also helped me get a better understanding of just how admin structures at VCH are and how decision making happens. And so it's one of these things like the more you're involved in these kind of things, the more you start to understand how they all work. And I'm still, I feel like in the early stages of this, but it's been helpful to understand these things. And it, like I kind of alluded to earlier, I think it adds some interesting diversity to my workday. So, it's nice to kind of take a break sometimes from dealing with clinical things to deal with something that's more like a project based or something that's where you feel like you're doing something positive with more of a long-term impact. And I think in lab medicine, I think we often take it for granted, but most of us have relatively flexible time. Like, yes, we're busy, but much of our work is fairly movable in a schedule. So I think as physicians, we're actually quite well positioned compared to some of our colleagues who might, be dealing with ORs or scheduled patients all the time to be involved in initiatives, whether it's planetary health initiatives or even other initiatives. And a lot of times we're at our desks, so it's fairly easy to respond to emails and attend virtual meetings and kind of be able to kind of, be somebody on a committee that's not like the person that only has like one or two availabilities in the doodle poll. Like we're usually more flexible than that. And I personally feel like we have smaller egos than a lot of other physicians. So I think in general, we work well on committees and projects. And so I think it's just good to remember that we could have a lot of positive impact if we get involved in things. And so really, I just wanted to kind of challenge this, and maybe this is what Rashmi was talking about as maybe the thing to end on. But, I just wanted all of you to just think about what interests and passions you have that you might want to follow and how might you get involved in some of these? Like how might you find the interplay between some of these interests in your work? And ask, also from a practical standpoint, will your division be supportive of you spending time on them? Like you do obviously have to be recognizing that you're part of a division that has work to get done. So make sure that it's still compatible with your division and they're supportive of it, so they don't kind of aren't, annoyed that you're in meetings for certain things that, they're not aware of. And then also ask yourself, like, it's always a good good thing to take a step back and just think, what are the projects and responsibilities I have, and are these things that reflect my interests and priorities? Or maybe some of these things, somebody else who's more passionate, maybe I should consider handing that off to someone else. And so it's always good to revise things. Like, don't just keep adding projects and stuff. Like, sometimes it's a good idea to pass something on to someone else, especially if they have more energy for it. And then really just also remember, like, as far as we know, we only have one life on this planet, and how can you make that work personally meaningful? And just ask yourself if there's initiatives that you think would be helpful to you to get involved with to increase that sense of kind of personal meaning and satisfaction. So those are just things I wanted to put out there, and we'll obviously have discussion towards the end. But I'll let Andre kind of talk maybe a bit more about like what are some actual activities and his kind of philosophical thoughts on lab medicine and utilization, and then maybe we'll have questions at the end. Thanks.
Thank you, Tyler. I know Andre has a lot of very interesting thoughts and perspectives on this, so we'll hand it off to him.
All right. Okay, so thanks very much for organizing this session, Tyler, and thanks to you and Rashmi for the presentations. I've tried to leave some time for questions, so I'll go a bit quickly through these slides. The first part I wanted to talk about is why clinical diagnostics and planetary health, how they're related, and then I'll talk a bit about what I'm trying to do in terms of, as a pathologist, trying to respond to this, broader issue. So, first of all, diagnostics and patient health. What's the relationship? Well, I think it's changing over time. So if we look at the broad view, what is Western medicine generally trying to do? It's assessing people, diagnosing them with diagnostics, and then posing or imparting a treatment plan, which hopefully will stop whatever etiology is causing disease. And it's treating sort of one person at a time in general, and it's treating people in the present, not in the future, or it's focused on the present. And so there's positive health influences I've got in green and negative ones in red. So human society is, as we know, one of the major factors that determines health. And for the most part, we live in a society which we encourage each other towards pursuing healthy lives, and that has an important impact on us. So that's how Western medicine works in general. And it began sort of really last in the 20th century. And I put it over here on the side because it's part of a bigger picture, which is how everything which ultimately leads to health comes from the Earth's ecosystems, which yield energy for food, for powering society, for nutrients, the minerals that we use. And human society, as we said, is impacting on health. In yellow, I've got the flow of funding, which powers the removal of these resources from the earth and the distribution through and transport within society. But after it's utilized, then there's no more funding. It just goes downhill. We end up with waste, greenhouse gas pollutions, toxins. Those go back into the ecosystem. Some of them get taken up, but there's negative effects on the ecosystem. There's also some, flow of materials and funding through Western medicine, which produces emissions and pollution, which contribute to these negative effects on our ecosystems and on the humans we're trying to treat. But overall, things were pretty good in the 20th century. Moving on to the early 21st century, we've got the rise of ecological determinants of health, which Rashmi spoke a lot about. and its impact on the biodiversity index, for example, which is going down over time. Our Earth's ecosystem are going getting systematically damaged and decreasing in what they can offer us in terms of free services. But they're still being mined. They're being we're taking oil, taking other minerals. Again, it's powered by funding, which again powers the incorporation of those new supplies into our products, which we use. But over time, society is becoming a more challenged, and we're getting a more negative influences in human society, I would argue, and that's impacting on human health, as are the negative effects, which are growing from the pollution, greenhouse gas, and toxins. Things like new forms of kidney disease in the equatorial region, and increasing rates of diabetes, proportion to the increase in temperature. So this health is being affected by other factors than traditionally thought of. And as we go forward into the mid-21st century, this is sort of the trajectory that we're on, where we have declining ecosystems. We're still able to extract resources, but it takes more effort, and we get more side effects. And as we are approaching limits, we're getting breakdowns in society, I would argue, that lead to competition over resources, which are becoming more scarce relative to need. And then that's having a negative impact on society, which is impacting patients. I think a lot of patients that we see in the clinic or in the hospital are suffering from essentially what comes down to a loss of self-care and actual self-harm. So I think that the important point here is that we go into clinic medicine, we go into diagnostics to try and help with health, but there's something happening that we have to keep aware of, even if it's not our area of expertise, it's not our passion, it's not our go-to sort of how can I help, because we are the champions of health in society, and there's a problem that needs to be addressed. So I think two things we want to do before we get to this final stage where it's really too late to help, and we're in a mass extinction, but it's essentially, how fast that happens is sort of determined by how we as a society react to the challenging conditions. So as purveyors of health in our society, the champions of health, I think that we want to keep this in mind, do what we can to minimize the impact of our medical practice on toxins and emissions. But also we want to provide an example to the rest of society, which ultimately has to change how it organizes itself in order for us to successfully confront this challenge. So it's twofold. Our responsibility is, one, to minimize our impact, which is substantial, but also to model a good response to this important situation. So how do we do that? Well, at a high level, I think we have to restructure the way we teach our trainees. We all learned that we don't want to harm the patient in front of us when we're considering our assessments and treatments. But that applies to the society as well as a whole. We don't want to do any harm to the society, not in the current generation. We want to provide a good handover to our colleagues who will be practicing medicine in the next generation. These are important. We want to use our power as physicians. We're to acknowledge leaders in society, and particularly when it comes to priorities in health promotion. So it's much easier for us to restructure the healthcare system than it is for politicians. So it's important for us to be proactive there. I think it's important to choose to practice where you can optimize health in this more broader sense. You want to work for organizations that are going to allow you and encourage you to work for health in this broader sense. It's always easier to take the short-term view about how to set goals that you can achieve and that are, readily measured and easily attained. But if they're not the most important goals, then that's not very much help. We need to focus on this overarching issue, which is trumping all of these current more easily attained goals in the short term. So whenever you're coming across diagnostics, how do I apply diagnostics to this case? Try to maximize your use of diagnostics so that the disability-adjusted life years of your patients are maximized. We all know about that, but we don't think about the bottom part of the equation, or the ratio, which is greenhouse gas emissions, resource extraction, and pollution, which I call GEEP for Jeepers. So we want to have a big impact on daily, but we don't want to have a big impact on Jeepers. We want to minimize that. And so whenever you're thinking of new programs, or people ask you to participate in a new program, or you're on guidelines or planning research projects, think about this. What are you planning? Is it going to help with this situation or make things worse? So on to specifics then. As I say, keep this ratio, the daily, how much help to patients are you providing relative to the GEEP? If we're going to, first of all, I think we want to keep doing what we're doing, but do it with less energies and materials and wastes. When we're talking about ordering and screening, if you're not really sure that more screening or more intense screening is going to have a big impact, you really don't have the data, then err on the side of the environment and screen less often and with less intensity. When you're collecting samples, how many do you need to collect? How often? These sort of things I'll just, the slides will be available, but I'll just go through a couple of more examples. So, as I said, if in doubt, screen less often with less intensity. In BC, we used to screen pre-2024 with more sensitive thresholds to diagnose gestational diabetes. So 14% of pregnancies had gestational diabetes. Other provinces who didn't have any reason to have a lower gestational diabetes rate, aside from more specific thresholds, were at 7%. And there didn't seem to be any health benefit to having this more sensitive screening in BC. So as part of a working group, we changed that, and now we're adopting the 7% gestational diabetes rate as in other provinces. So the impact of that is fewer people diagnosed, fewer follow-up appointments, tests, interventions, monitoring, neonatal hypoglycemia diagnoses, which you're going to find more neonatal hypoglycemia, but how much are you helping those patients is not. There's no evidence that you are, so let's err on the side of the environment. Sample collection, how often, how many, diabetes, there's some recommendations. You should test every 3 months, but do you really improve diabetes outcomes as compared to testing on an annual basis? I'm on a CKD GPAC guideline, and so there's recommendations for screening everyone who's not white every 2 years with a creatinine and urine albumin to creatinine ratio. But when I look at other countries who have non-white populations, they're not doing that. So I think a more reasonable thing is to look at people who have a family history of CKD and hypertension and diabetes and do the screening in a more narrow group. Fewer office visits, fewer lab visits, sample collection. This is all going to help. It's not going to make a big impact if one small community in the world does this, but again, we're hoping to make changes which others will catch on to, and globally will start to make an impact. Some basic things like how often do you need to store or how long do you need to store samples? At what temperature? This makes a big difference to the energy utilization in the lab. The freezers and fridges are huge energy impacts, and if you can store things for a week instead of 3 months, if you can store things at 4 degrees instead of frozen, your need of freezers and fridges will go down, and that's important. Some of these panels that people like Dan Holmes and Janet Simons worked quite a lot on limiting inclusion of tests on standard liver panels. I'm working with the renal group on CKD panels, and more information. We like to have more information, but if it's not clearly making an improvement in DALYs, then we're just increasing that Jeep, and we don't want to do that. So let's err on the side of the environment. In the Providence lab, we underwent a reorganization of how we're doing our lab testing when we got new analyzers in 2023, and Dr. Fang studied this quite intensively and ended up reducing the number of sample containers that we used. So in the top line of this table, between April and October 2024, same number of tests, but we were able to reduce the number of sample containers by 40% just by sharing them when we could, making sure that that was easily done. The number of containers per collection went down. We went from polystyrene to polypropylene tubes, which is a minor change in the right direction. Labels from plastic to paper. Freezer storage space, because we went through all those storage requirements, went down by 67%. So we were, at meetings and people saying, well, we need a new freezer because everything's full. And so no, we didn't need a new freezer. We needed to use the freezers better. So it's just a lot of simple things like this. And I'll leave it there so we can have a few moments to discuss. But there's a lot we can do. It seems quite small and unexciting, but it is really important work, and we want to do this, document it, share it, and so that we can provide a benchmark for other labs around the world to follow, and as they say, the healthcare system as a whole can provide an example for other sectors in society which need to change as well. So I'll leave it there.
Great. Thank you so much, Andre and Tyler and Rashmi, for all these insightful things. I think this all speaks to, this at least my own perspective on this is that we're all pushing sort of for better health outcomes, but of course this always comes at a cost. Personally, my feeling is that our achievements in health outcomes are sort of plateauing a bit, but on the flip side, the environmental costs of each of these activities are sort of accelerating on the flip side. So this ratio that's the denominator, environmental denominator in this that Andre speaks to, I think is a very important perspective that we should all keep in mind when we're taking on new initiatives and bringing in new tests and such. And so hopefully we can all keep that in mind as we are important stewards of utilization in medicine. Maybe I'll see if anyone has any questions in the group. Jennifer, please go ahead.
Hi, thank you. I'll try and make this a quick one. This is for Dr. Chadha. I was just wondering how far she thinks we've come on both the micro and macro levels to improve health accountability. And by that, I mean, like, for example, with individual patients, ensuring they're responsible for their own health as opposed to just prescribing them. There's a pill for that. And how far have we come with holding companies that are profiting from the sale of unhealthy products fiscally accountable for the downstream negative health effects? And on that fiscal note, can we replace that tax-based income that our governments receive from products that do cause harm, for example, tobacco, alcohol, gasoline, to perhaps moving from that to taxing the companies that are profiting?
Strangely, I see Rashmi.
I think we lost her.
Lost her somehow here? Oh no.
She's at home right now, so
Yeah,
Maybe my question
there was
scared
some
her right
connection
off.
issue. Maybe her question was too difficult, Jennifer. No. She must have just lost connection.
yeah, she must have.
Oh no, that's really unfortunate.
Andre, do you want to speak
Oh,
to?
there she is. Oh, there she
there we
is.
go.
Sorry, my
Yeah.
Wi-Fi just inexplicably dropped, so I'm now on my hotspot.
Oh no. Yep, all good.
Sorry, I missed it all.
No worries. Jennifer Zanakis here had a question for you. Would you mind quickly restating the question, Jennifer?
Sure, Dr. Chadha, thank you so much, by the way, for your presentation. I was just wondering how far you thought we've come on the macro and the micro levels with accountability. For example, with individual patients, are we moving from making them more responsible for their own health as opposed to just prescribing medications? And on the macro level, how far are we coming to holding those companies that are profiting from the sale of unhealthy products accountable fiscally? For example, do you think we can move from that tax-based income that our governments receive from the sale of harmful products like tobacco, gasoline, alcohol, to possibly taxing the companies that are profiting?
Oh, I love this question. I absolutely agree on both fronts. So on the micro level, we're doing nothing at the moment. I was just teaching at UBC an MPH course on planetary health, and really there's very little. We as physicians aren't really talking with our patients about these things, and actually I've started doing it in selected patients, and I'm always quite interested to see responses. And one of my colleagues is a family physician, and she started incorporating it more into her conversations, and patients are making decisions based on their value system, which for me, for example, my value system would entirely have a planetary health lens in things that I'm offered as testing and things like that. So I think it is a conversation we need to have. If speaking to that, in November, we're going to have a shared ethics conversation. It's going to be a roundtable for Vancouver Coastal, but we're trying to make it provincial. So all of you would be welcome to join, because ethical questions will start coming up because of lack of understanding and knowledge. So that's the micro piece. I think there's a lot of work to be done. The macro piece, I absolutely agree. It's kind of crazy that it isn't an exact flip, just like how we should be offering plant-based food in hospitals as disease prevention and health promotion. We should absolutely be doing the same things that are not harming our planet or our health should be rewarded, and not the opposite way, which is what it currently is. Sorry, I don't have any answers for that, but folks around the table, whatever levers you have, I would encourage you to use them. I found out today that Interior Health has a MHO report that speaks to the same things as our Vancouver report. So I think the medical health officers are stepping up, and at the Ministry of Health, there is now a provincial health officer for planetary health and water management. So these structures are getting placed, and I think with those structures in place, more action will be able to be taken at these bigger levels.
Thank you so much.
Great, thanks. Maybe just one last question here. We've hit 1 o'clock. Krista, please.
Yeah, sorry, this might be a loaded question, but I'm wondering about your thoughts about diagnostics. So, more like biopsy procedures that we often have. I'm a hematopathologist, so this would be like bone marrow biopsies that not all the time, but often seeing patients who are quite old and may not benefit from any actual diagnostic answer, getting procedures like bone marrow biopsies. I'm wondering what your thoughts are on if this is something that, from an environmental lens, we should be potentially pushing back on accepting these requests for these types of procedures, and at what point does the ethical considerations come into play?
I'm going to let Andre answer, but going to really quickly say that this is something that I'm hoping starts getting tackled. That's why we're having the ethical forum. I think it's a really important question. We're talking about non-beneficial care from an ethical perspective. And I do think these are the sort of things that need to start being looked at from a health equity and generational equity perspective. But over to you, Andre. I'm really interested in your thoughts too.
Yeah, I like your question. There are choosing wisely recommendations that should address this partially. There's aligning goals of care for the patient, with the investigations you're ordering. So yeah, it depends on the given case, but yeah, a lot of times you would, if you look, first assess the goals of care, then these investigations would not be taking place, and so I think we should, follow that practice. That's, more generally, I think that we need to encourage clinicians to check in with their patients about the goals of end of life care, but also their goals for green care and at what rate is a misdiagnosis okay? Is it 1 in 1,000, or is it 1 in 100, or for a treatable condition? How do we balance that, right? When we use our diagnostics, are we using them in a way that's in line with what the patient would want? I think that the clinical guidelines also have to just come in and start addressing this issue as well.
Great. I guess we're already at 1:05, so I guess we'll have to wrap this up. The truth is, we're probably just at the very start of a day-long conversation about this. So, but I wonder if maybe I'll speak with our wonderful speakers today, and maybe collect up a series of links and resources that we can then share back with the lab medicine group. But again, thank you so much to Dr. Rashmi Chadha, Tyler Smith, and Andre Mattman for giving us their perspective on this, and hopefully it really sparks some thoughts into how we can all, as individuals, contribute and make headway into improving planetary health through our daily work activities. So thank you everyone again for participating, and we will keep in touch on this topic.
Thanks for sharing, Tony.
Thank you.
Bye, everyone.
Bye, everyone. That was fun.
Yes.
Can we stick around for it?
I think so. That was a terrific presentation. Thank you.
Yeah, I enjoyed all the presentations. Super fun. Are they going to throw us off?
I guess no. I think we're co-hosts, so we can stay on for a bit here.
Oh, that's good. I'm sorry. I don't know. Some loud vehicle went past, and my Wi-Fi just went, which is perfect.